Hi, I'm Chris Goodwin with Insurance Pros, and I'm happy to be talking with you today about solving the Medicare puzzle. Medicare can be a confusing topic. However, in a few short minutes, you will know a lot more about Medicare than people who have been on Medicare for decades. First of all, we approach the question, what is Medicare? Medicare is a national health care program for those 65 and older, and it happened to be established in 1965. Now, people who are under 65 also get to use Medicare if they have been on Social Security disability for at least 2 years. As long as you or your spouse have paid into the Medicare system through payroll taxes for at least 10 years, then you automatically qualify for Medicare. When can you enroll in Medicare? Medicare's initial eligibility period is the 3 months prior to the month of your 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. One of the most common questions that we get is, what if I remain on employer-sponsored coverage at age 65? Is there something that I need to do? Do I have to join Medicare? And quite simply, the answer in most cases is no. You don't have to join Medicare at age 65 if you remain on employer-sponsored coverage, especially if your employer has at least 20 people on payroll. The reason for this is that Medicare will be secondary to your employer-sponsored plan if you are turning 65 and you are going to remain on that employer-sponsored coverage. Now, when Medicare is secondary to your plan, a lot of people get Medicare Part A only. However, Medicare Part B costs no less than $164.90, so often it doesn't make sense to pay for Part B coverage when you have employer-sponsored coverage. Now, when you finally retire, you will have what's referred to as a special enrollment period to join Medicare at that time. When you're within 90 days of leaving that employer-sponsored plan and going on to Medicare, you'll need an L564 form to show that you've maintained credible coverage through an employer since the time that you turned 65. An employer will actually sign this document proving that you had coverage leading up to going on to Medicare, and you will realize no penalties. Now, if you're the spouse of someone who was on an employer-sponsored plan and you're enrolling in Medicare outside of your initial eligibility period, you will also need an L564 form. Talk to us more about how this form works and how to acquire Medicare Part B outside of your initial eligibility period. Now, let's talk about the parts of Medicare. There's Part A, there's Part B, and there's Part D. Part A of Medicare is called hospitalization insurance. This is the part that has no premium. Now, in addition to having no premium, Part A requires no medical underwriting, so it is guaranteed issue coverage. What's covered under Part A? Well, here are a few things. Part A, hospitalization insurance, covers inpatient hospital care, inpatient skilled nursing care, hospice care, home health services, and other inpatient benefits. Mainly, Part A is covering the facilities. Now, Part B covers virtually anything considered to be medically necessary. So if it's not cosmetic or experimental, Medicare likely has a code for that service. Also, preventive services are covered under Part B, and not only are they covered, but they are covered in full. So certain preventive services will be covered at no out-of-pocket to you when on Medicare Part B. This might include annual checkups, blood work relative to a checkup, COVID testing, and other preventive screenings. Now, Part D of Medicare is outpatient prescription drug coverage. Now, if you're getting drugs while hospitalized, that will likely fall under Part A of Medicare. If you're getting drugs through a provider's office, that will likely be covered under Part B. However, if you need to access drugs through a mail order or retail pharmacy, then you will need Part D coverage. Now, unlike Part A and Part B of Medicare, which come directly from our government, Part D of Medicare is purchased through private insurance companies who are approved by Medicare to offer their plans. Most major insurance companies offer Part D plans, and there are dozens of Part D plans in every market. Putting the pieces together, we have Part A, Part B, and Part D. That's inpatient coverage, that's outpatient coverage, and prescription drug coverage. And most people feel pretty whole when they have Part A, Part B, and Part D. However, later, most people find that there are some missing pieces in Medicare Part A and Part B. Let's talk about some of your exposure under Medicare Part A. First, if you have Medicare Part A, you are responsible for the hospitalization deductible. The Part A hospitalization deductible in 2023 is $1,600 per benefit period. Now, a benefit period is basically each time that you might be hospitalized. The only time that you do not realize a benefit period is if you're being readmitted shortly after being released from a prior hospitalization. But the $1,600 deductible is all that you owe the hospital for up to the first 60 days of a given hospital stay. Now, if you're in the hospital for more than 60 days, then you now realize $400 per day in hospital daily co-payments. Now, this is day 61 through 90. And after day 90, your responsibility increases to $800 per day. And anytime you're in the hospital more than 90 days, you are using what Medicare refers to as a hospital reserve day, and you only get 60 of those before the government requires that you pay all of your hospital stay. Now, if you're ever released from the hospital, but you still have to rehab on an inpatient basis, then Medicare fully pays for the first 20 days of skilled nursing. After day 60, you are now responsible for $200 per day if you remain in skilled nursing during inpatient rehab. If you are ever on hospice, Medicare pays hospice very well. However, you do have some responsibility when it comes to short-term nursing, referred as respite care, and also some pain relief medications. Under Medicare Part B, you are responsible for a calendar year deductible of $226 per year. This calendar year deductible is based on the first $226 of Part B services. Once you've realized your Part B deductible, Medicare shares the cost with you on an 80-20 basis. Medicare will pay 80% of the Medicare approved amount, leaving you with 20% of the Medicare approved amount. Now, most doctors who coordinate with Medicare take what's called Medicare assignment, meaning they don't charge any more or any less than the Medicare fee schedule. There are a certain few providers that actually charge what's called excess charges. Now, these providers can charge as much as 15% more than the Medicare fee schedule and still coordinate with Medicare. If you work with a provider who charges excess charges, then you may be responsible for this balanced billing. Another charge under Medicare Part B is the first 3 pints of blood. If you need blood, whether inpatient or on an outpatient basis, the first 3 pints of blood will be your responsibility in cost. Now, there are a couple of major ways to mitigate some of the out-of-pocket associated with Medicare Part A and Part B. The first way to mitigate this responsibility is through purchasing a Medicare supplement. Now, under this structure, you continue to be covered under original Medicare's Part A and Part B. You purchase a prescription drug plan, and you purchase a Medicare supplement. A Medicare supplement will cover some or all of the deductibles associated with Medicare Part A and Part B. The other way to be covered under Medicare is through a Medicare Advantage plan. This is Medicare Part C. Under a Medicare Advantage plan, the government is outsourcing you to a private insurance company to manage your Medicare claims. Let's talk about Medicare supplements. Medicare supplements are basically insurance policies that pick up where Medicare leaves off when it comes to the out-of-pocket associated with Part A and Part B. And we'll share with you a table that actually shows you every Medicare supplement plan design available. So Medicare Supplement A will pick up some of the deductibles associated with Part A and Part B, but will leave you with a significant amount of out-of-pocket. Medicare Supplement Plan F covers virtually all of the out-of-pocket associated with Medicare domestically. This means that after Medicare pays its portion and your supplement pays its portion, you will have no out-of-pocket with Plan F. Plan F is so popular that the government discontinued offering Medicare Supplement Plan F and Plan C through a law called MECRA. This is the Medicare Access and Chip Reauthorization Act. Anyone joining Medicare in 2020 or beyond is unable to purchase Medicare Supplement F or Medicare Supplement C. The richest Medicare supplement in benefit in today's market is Medicare Supplement G. Under Medicare Supplement Plan G, Medicare pays its portion and Plan G pays its portion, leaving you only with a Medicare Part B deductible. In 2023, this is $226. Medicare supplements are homogeneous and standardized. According to the governmental document Choosing a Medigap Policy, cost is usually the only difference between Medicare supplements with the same plan letter sold by different insurance companies. This means Plan G is the same with Blue Cross Blue Shield versus Aetna or United Healthcare. Furthermore, the government's handbook states that there can be big differences in the premiums that different insurance companies charge for exactly the same coverage. So it's important to compare companies when shopping for a Medicare supplement plan. So, in summary, Medicare supplements work well with Part A and Part B to give you more complete coverage. There are no network limitations, so you can use anyone who actually accepts Medicare. There are Medicare supplement plans called Medicare Select plans that offer the same coverage with a limited hospital network at a lesser cost. There is little to no out-of-pocket expense with Medicare supplement policies. And you don't have to requalify. Medicare supplement plans are guaranteed renewable. Now, let's talk about Medicare Advantage plans. Up until now, we've been talking about using Medicare Part A and Part B as your primary insurance and using a Medicare supplement to cover some of the deductibles and other out-of-pocket. If you choose a Medicare Advantage plan, then the government is effectively outsourcing you to a private insurance company to manage your claims and provide your Medicare services. So let's talk about what's happening here. Essentially, the government is paying the insurance company a set amount per month should you sign up for that Medicare Advantage plan. And the government does require that company do three major things in order to get paid a fee. That company must provide actuarial value that is at least equivalent to you being on Medicare A and B only. This means that your Medicare Advantage plan cannot have costs that are likely to outweigh the costs should you have been on original Medicare A and B. Now, the second thing that your plan has to have is adequate coverage. What this means is that your network, whether an HMO or a PPO, has to actually provide you with enough providers so that you can reasonably access care. And the third thing that a Medicare Advantage plan has to offer is covered services that are the same as the services you would have realized under original Medicare A and B. So, if MRIs and CAT scans are covered under Part A and B, that has to be covered on your Medicare Advantage plan. In most cases, a Medicare Advantage plan will not only cover all services that original Medicare offers, but your plan might cover additional services that Medicare does not cover, like eyeglasses or hearing aids or over-the-counter allowances or dental. A Medicare Advantage plan may, in some cases, go beyond actuarial value that is required by the government. So, Let's review some more things about Medicare Advantage plans. With a Medicare Advantage plan, a private insurance company administers coverage and manages all of the claim. With Medicare Advantage plans, you still will pay Medicare Part B. This is required in order for the government to actually pay the set fee schedule. Let's talk about who should consider Medicare Advantage plans. First of all, there are low utilizers of healthcare services. Oftentimes, if one doesn't use healthcare services, then they are not likely to pursue the premiums associated with original Medicare, a supplement, and a prescription drug plan. Secondly, there are those who value the managed care aspects of Medicare Advantage plans. When you have a Medicare Advantage plan, the insurance company is going to partner with you on healthcare decisions and other programs that improve your health. If you value this, you might enjoy being in a Medicare Advantage plan. Thirdly, those whose providers are in network. It is most important when considering a Medicare Advantage plan to make sure that your providers accept the plan that you are choosing. Also, those who value the extra services and benefits. If you want to integrate dental, vision, even hearing aids into your plan, and that's important, then you may want to take a look at a Medicare Advantage plan. And finally, there are those who value the savings over original Medicare with a supplement and a prescription drug plan. So if the monthly savings is important to you, then you could be one who values a Medicare Advantage option. Let's talk about a few of the potential drawbacks to a Medicare Advantage plan. Every year, the government decides on how much they will actually fund Medicare Advantage plans. This can change from year to year, and this could affect the structure of your plan for the following year. Also, plans will change on an annual basis, indifferent from any funding from the government. So you might find that there are provider differences from year to year with a Medicare Advantage plan, and there are benefit differences from year to year. And finally, there may even be co-payment differences. If these change dramatically, you may decide on whether or not to stay in your Medicare Advantage plan. Thirdly, there is no guarantee that you can qualify for a Medicare supplement later on down the line. In fact, if you are not in a trial period, which is the first 12 months that you've ever been in a Medicare Advantage plan, seeking a Medicare supplement plan will likely require underwriting, which can be disqualifying if you have a chronic health condition. So these are several things to consider when pursuing a Medicare Advantage plan. Now, Medicare Advantage plans are exclusively sold and enrolled by CMS certified agents in order to protect the rights of seniors. This means that there's a very specific and compliant way of addressing the specifics of any given Medicare Advantage plan or Part D plan. I hope that you got a lot from this talk, and we look forward to helping you more with your transition to Medicare. If you have questions, you can call Insurance Pros at 913-944-4465 or simply email us.